Well, new tonight, an East Texas ICU nurse is recovering from heart surgery this week at the same hospital he's been practicing for nearly 10 years. Our Dan Millay joins us now to tell us the story of Brandon Gill, the support he's received, and how he's aiming to turn his situation into a positive.
Yeah, exactly a month ago, I was on vacation in Oklahoma, and my heart went into an irregular rhythm called AFib RVR, and I was treated at a local ER there.
For 32 years, Brandon Gill says that as far as he knew, he was completely healthy. He's a runner, and he says whenever he felt any sort of discomfort in his chest, he just chalked it up to dehydration or stress. However, after a trip to the emergency room, then a prompt follow-up with a cardiologist, Gill learned he was born with a bicuspid aortic valve. It basically means his heart needs to work harder to pump blood to his body than most, and that he would need an aortic valve replacement. Understandably, this was hard for Gill to hear at the time.
When I first found out, I just kind of felt alone and isolated, and you just don't feel like people can understand, I guess.
But it was his friends and colleagues at UT Health that kept his spirits up when things were looking bleak.
They made me feel so incredibly good that I felt confident, going into it after speaking with them and hearing, the kind words they had to say about me.
They did a bit more for Gill than just give him some kind and encouraging words. They launched a GoFundMe to help him pay for surgery and his recovery process, an amazing and overwhelming gesture that's already raised nearly $8,000.
To have them just show it in this way has been incredibly overwhelming, and like I said, it's just beautiful to see that everyone loves him the way that I love him too.
A beautiful gesture indeed, but it sounds like that's just the culture among nurses at UT Health. They're a family that looks out for each other.
It's not often you get to come around people that are that good to each other. It's a lot of love in my heart for Brandon and the entire team.
Brandon has been working as a registered nurse for about 10 years now, and by all accounts, he's very good at his job. But he says that this change in perspective and seeing things from the patient's point of view is going to make him an even better nurse going forward.
I'm in the same spot that I don't know how many people have been in this seat, but I mean, I've taken care of, I bet, thousands and thousands of patients. My nursing career will be better than it's ever been due to this process, and I'll be able to communicate a lot better with the patients for that.
Now, recovery begins for Gill. He hopes to be released from the hospital within the next few days, when he'll then get started with physical therapy. He wouldn't be here today, though, without his friends, family, and
my work family. I love you.
In Tyler, Dan Millay, CBS 19.
East Texas, you know what to do. If you're interested in donating to Brandon and the Gill family, we have the link to his GoFundMe on our website, cbs19.tv.